attend a wedding of a 9-year-old and you keep quiet, and you're enjoying, you're there to have the fun and party and eat the food. I think at that point in time is where we come and do a sweep and arrest everyone who has attended, and we would be able to deal with it in that way. So it is a great thing to be paying attention to. We might have dealt with the monetary poverty at some particular instant. I know that the government is pushing for the parish development model, but how about the other aspects of multidimensional poverty? When it comes to access to health and education and safe water and housing, are the children a part of that, or do we still see them on the streets, being ferried to come and beg? We still had a story whereby children were being bought at as low as 5,000 shillings. You could be able to go to Karamoja, unfortunately, to speak about the region. Go to Karamoja. They have markets that sell children, young girls. 5,000 to 50,000. You have a bride for yourself. Or you get a girl who the parents do not even know. Some of them are duped and told, oh, I'm taking this child. They're going to go outside. I'm taking them to Kampala for better education. And they never follow up at the end of the day. Do we have the laws and policies that protect these children? Do we have those laws and policies? Yes, they could be in black and white. Are they enforced enough? Do we enforce them as the community ourselves? Because sometimes we tend to say, the MPs will enact the laws, then police will deal with the enforcement. But do you realize, do you understand that you as a community member, you could be perpetuating crime against children because you're not speaking up? Because you're just living and saying, the child belongs to the other neighbor at the end of the day. So ladies and gentlemen, I think it has to be a holistic view and a holistic thinking of having to deal with children issues. And I love that much later on we're going to be looking at a presentation of a paper on the situation of children. It could be alarming, but whatever it is, a journey of 1,000 miles starts with one step. Where are we? Where do we start? What are the salient issues to deal with when we are talking about children? Those are what we will be paying attention to. And like I said earlier on, we are going to be live. UBC Television is going to be broadcasting this live, and I do request that we do minimize our movements as we go through. But ladies and gentlemen, in just a minute, I will be inviting Honorable Sevonya Chivirige, who will also be giving us an overview of the National Dialogue on Children Welfare, but will also be in the same capacity representing the Permanent Secretary Office of the Prime Minister. And just before I get Honorable Chivirige, there are stories. Some of these are jaw-dropping, but it is actually the reality. And actually, before you go back, please kindly come through and let us in on your story. And Honorable Sarah is actually here. Ladies and gentlemen, we welcome our guest of honor. We could stand up and welcome her. And before we even get to listen to the story, we would like to officially, Honorable, thank you so much for sparing time of your busy schedule to make sure that you come and talk with us. Honorable Nyirabashiti Sarah Mateke is the Minister of State for Youth and Children Affairs, and I know well in her docket she understands. And before we do anything more, I would request that we take on the anthems, starting with the Uganda anthem and the East African anthem to our technical team. If you could give us that immediately. Thank you. Thank you very much, ladies and gentlemen. You may get seated. Honorable Sarah Mateke, as you did come through, we had an overview discussion about the state of children, and this is as Dr. Munir Safieldin, the UNICEF rep, joins you at the high table, and also Honorable Flavia Kabahenda, who is the chairperson, Uganda Parliamentary Forum on Social Protection. I do kindly request that you give me just 3 minutes before I invite our first speaker and listen to just one story of the children that will bring us to the realization of how much we need this discussion and how long ago we should have involved in such a discussion. Let's welcome her with a round of applause.
Good morning, everybody. My name is Zainab Ali from Kampala Primary School. I have just had for my primary living examination. This is my journey, my story in 2022, during COVID time. During COVID time, COVID affected us, we as children, a lot. During COVID, I was at home, doing nothing. Me, I stay with my grandmother. I don't stay with my parents. My father called my grandmother. He wanted me to go in the village to help my grandfather. Then my grandmother sent me in the village to go and help my grandfather. Reaching the village, my father had organized for me a marriage. Just because of COVID, he was saying that I'm now too old. I'm not supposed to be in school. He was telling me that children are not going to go back to school now. COVID is going to be there for like 4 years when we are not schooling. So I'm too old. Let me go and get what? Let me go and get married just because of COVID. Me, I wanted to go back in school just because of Girls Empowering Girls program. They're the one who helped me to come back to school. So I'm thanking them. And I'm calling upon all leaders who are there listening to me to fight for other girls who are not there in the program, because our friends are there suffering and there are no people who are helping them. I'm calling upon kindly all the leaders to come up with a program to help other girls who are passing through the same thing which I had passed through. Thank you.
Well, there's so many other girls just like Zainab Ali who probably didn't even manage to escape the marriage. They've gone through the marriages, and the medics will tell you that the rates of deaths of mothers giving birth have gone up, but also just fistula itself, because these are still young children, a child giving birth to a child, the rates of fistula have gone up, and it is even worse for correctional services for young girls such as Zainab Ali. So I think the call has been made, and you made it loud and clear because the Honorable Minister is right here. Ladies and gentlemen, without any further ado, allow me invite Honorable Sebunya Chivirige to give us an overview of this dialogue and just how important it is. Over to you, Honorable. Thank you so much.
Thank you. You are all welcome. We are sorry we are beginning late, but all the same, we shall do the task. I welcome the representative of UNICEF in Uganda. I also welcome the Honorable Minister of Youth and the attending portfolios. I also welcome Honorable Kabahenda from the Parliament of Uganda. Here, not on my behalf, of course I would have been here as the head of the delivery unit, but I'm representing the PS OPM, Office of the Prime Minister, Mr. Mahakanizi. But also, we had arranged with the UNICEF and the ministry that this series would be presided over by the Prime Minister. Unfortunately, she was due for Japan to represent the First Lady. But we hope that the more series that will come, she will preside over as the Prime Minister to show the importance of children in this country. In fact, the children, the youth, now we have a bigger cluster of child mothers and young fathers. So I think it is very important at this time that we prioritize them. Over the past 2 years, government of Uganda faced the challenges of navigating the direct and indirect implications of COVID-19 pandemic. While minimizing the worst of the pandemic social and economic disruptions, Although children managed to avoid the worst health outcomes associated with the virus, they will likely bear many of the long-term effects of the pandemic, as we have heard the young girls say. From reduction in routine immunization coverage, to increased reports of violence against children, to lost months and years of learning. These outcomes have not been unique to Uganda. The latest Human Development Report, which is international, 2021-2022, released on 8 September 2022, documents the adverse effects of COVID-19 around the world. And for the first time ever, the Global Human Development Index value declined for 2 years straight. It declined. Given the current historical moment, UNICEF, I'm talking on their behalf, believes that the dialogue series on child welfare can provide a platform for introspection and thought leadership on the situation and future of the children in Uganda. UNICEF also believes that such series can complement key opportunities for investments within Uganda's budget cycle, while encouraging discussions, reflections, innovations that will put more children in Uganda on the road to recovery and resilience. What are the aims of this dialogue series? The goal of the dialogue series is to draw on insights from research and current programs to help generate recommendations that will shape and improve policy interventions and investments for children across Uganda. Part of this will involve making evidence-based arguments as to why investing in social sectors makes economic sense. The convener is UNICEF. UNICEF proposes that the dialogue series be co-hosted by UNICEF itself and the Office of the Prime Minister, with our Prime Minister, Honorable Nabanja, presiding over each of the events. That means there are more to come. Overview of the situation of children in Uganda. Uganda has a relatively young population, with more than half of all the citizens, that is around 56%, under the age of 18 years. The age dynamics in Uganda provide a potential resource base for future demographic dividends, if properly harnessed by government. Indeed, over the next 2 decades, today's children hold the potential to transform Uganda's economy while remodeling the socio-economic future of our nation. Over the past 3 decades, the government of Uganda enacted an array of policies that have substantially improved educational attainment and health outcomes among children and adolescents in Uganda, while reducing the monetary poverty by more than half. Unfortunately, many of those gains were slowed and in some cases rolled back in the wake of the COVID-19 pandemic. Literacy levels in lower primary, for instance, worsened during the COVID closures. We know we closed for 2 years and more. While reported pregnancies among girls between 10 and 19 increased, in some cases, in some areas, drastically above their pre-pandemic averages. The issue of teenage pregnancy has been of special concern to UNICEF given its status as an important contributor to school dropouts and a top cause of death among adolescent girls. Indeed, 18% of annual births in Uganda are a result of teenage pregnancies, while nearly one-half of all maternal deaths are in adolescent girls. On the poverty front, the government of Uganda has made remarkable progress in its quest to eradicate monetary poverty. Indeed, between 1992 and 2020, the proportion of the population living in monetary poverty fell drastically from 56% to 20%. However, serious challenges persist, especially in as far as children are concerned. COVID-19 drove 2 million Ugandans into monetary poverty. Yes? Between 2020 and 2021, while rates of multidimensional poverty have remained high, which can hinder access to health care, education, safe drinking water, inadequate clothing, regular meals, and shelter that is not overcrowded or squalid. Before the pandemic in 2020, an assessment of the multidimensional poverty that was undertaken by UNICEF suggested that under half of all Ugandan households, 47% experience multidimensional poverty, while 56% of children below 18 experience some of the highest rates of multidimensional poverty throughout the country. That is, COVID-19 likely worsened those statistics, although we currently do not know to what extent. I think things have gone worse since we have completed COVID and now entered into another phase of Ebola. Children across Uganda are struggling with these and other challenges, including FGM, cultural excesses, domestic violence, and child abuse, which will require targeted investments above and beyond the current financial year 2021-2022 budget. Yet, marshalling these investments will mean having difficult discussions about trade-offs, especially given the current global economic context characterized by inflationary pressures at home and in donor countries. It is so worse that when we have all these problems, again, we have a global economic downturn. Energy crises, political instability in Europe, and ongoing humanitarian emergencies in different pockets of the world, including the Horn of Africa, which is adversely affecting Karamoja. What will such dynamics mean for children in Uganda in the months to come? What are the costs of inaction? If we did nothing, what will happen? Which are the greatest priorities for the government given the limited resources? These are the larger questions that a dialogue series about children can raise, while providing government experts, practitioners, and researchers with space to engage each other about the priorities, opportunities, and support needed to ensure that children have access to the kinds of inclusive and sustainable opportunities that can reap dividends in the years to come. I'm happy that the theme for today is recovering the lost gains for children in 2023-2024 budget cycle. I thank you, and thanks for listening to me.
Thank you very much, Honorable Chividige Sebunya.
Just a moment, I just want to say that I'm Kasura Robert Sebunya, much as I also welcome the name Chividige, but I'm the head of the delivery unit here, and I'm not alone. I'm supported by Alice Doya, the head of the education thematic areas, the team leader. I'm also supported by Mr. Tebenkana, expert education. I have Madam Honorable Rose Mbabali. She's also our head of the public sector, thematic area team leader. I have Engineer Komgisha, and I have the one and only who has organized this symposium and engagement, Dr. Julius Okello. More claps for Okello. He has put this symposium together. And we shall also be addressed by Dr. Inidi, part of our team in the delivery unit. Dr. Inidi, please, you better introduce yourself before you are called upon. Just stand up. Dr. Inidi shall be part of the expert presenters. I thank you.
Thank you very much, Honorable Sebunya, for that. And I think you mentioned one key aspect that we also had tackled, that nearly half of the maternal deaths are reported in adolescent girls. This could emanate from them just skipping to go for the antenatal, or because even when they go, they are mistreated and never want to come through. So there are lots of complications that do come through. But also the fact that they're still young and their biology may not accept them to bear children, the easier way, issues with preeclampsia coming in, and they do not know just how to be able to run around it. So there is just a lot about having to deal with children. And I love that Honorable asked the costs of inaction. I want each and every one of us to just think, if we did nothing and paid a deaf ear and acted blind, that nothing is happening and we're not listening to anything, what would the future hold for us? That is a question to ponder upon. And without any further ado, ladies and gentlemen, I would like to, still looking at the situation of children in Uganda, get a particular presentation report from Mr. Tawanda Chinembiri, who is the social policy manager at UNICEF, who is going to give us a much broader perspective of the current situation of children. And I know that UNICEF has also done quite a lot of research, and also not just research to find out what the problem is, but suggested a number of recommendations to how some particular issues can be dealt with regard to the situation of children. So ladies and gentlemen, with a round of applause, allow me welcome Mr. Tawanda Chinembiri to give us an overview of what UNICEF has found out as the situation of children.
Good morning, colleagues, ladies and gentlemen. Thank you very much for gracing this occasion. I'm going to be making a very, very high-level presentation. It's not really going to get into a lot of details in terms of what we see as the perspectives of what's really happening with regards to children. But I know that our high table are, sitting facing the other side. But please feel free, to join the first row so that you're also able to, to follow the presentation. I'm also told that the chief guest will also be coming in shortly as well so that they can follow the presentation. But please feel free to join the front seats for now. So thank you very much again. So my name is Tawanda Chinembiri. As introduced, I'm with UNICEF, making this very short presentation. So the essence of this presentation is basically just to try and give a little bit of some context and some insights in terms of what we see as the situation of children, in Uganda. So that this is just as a precursor to, I think, the detailed discussions and exchanges that are going to be led by our panelists as soon as the presentations are done. So thank you very much. So, look, when we talk about children, today I will try to really speak like a child, because I believe I'm a child. I belong to someone. I have a mother and a father. And to me, whether I'm 10 years, I'm 15, I'm 20 years, I still remain as their child. So I'll continue speaking like that. Us as children, we as children, please forgive me for using that language. But I think, the very first thing that we need to we also think about, as we're talking about children, is that you can't really divorce children from the economy. Whatever is happening to the economy has an impact on children. When the economy is growing, when the GDP is growing, the GNP is growing, it also impacts on children. So we also need to situate the children within the context of what's really happening within the economy. I will not spend time here, but basically, showing that the economy, as the economy was growing, I think for the bulk, of the years, we see that the economy was growing. The Ugandan economy was growing, right? This presentation, this slide basically shows that one. The economy has been growing, but has it really been sufficiently growing enough to really be able to impact on outcomes for children? So the first, graph that you see on the left here basically shows what's really happening in terms of some of the sectors that have really been growing so well. And when you look at this, the services sector, for Uganda has really been growing so well. And this is really quite good. You're looking at about 44% on an annual basis for the year 2021. But the question that always comes in is when you see these growth numbers, what exactly do they mean in terms of the quality of the service or the services that are basically growing so fast? So mostly you realize that this is like a very small petty trade, border riding, and those kinds of things which are basically growing this fast. And is that sufficient enough to really be able to uplift the children, from the situation where they are, their access to health services, their access to education, water, and so on, can really be guaranteed? It might not be because of the quality of those services. To the right, I think it's just a graph that basically shows, in terms of the structure of the Ugandan economy, that mostly when you compare, normally I'm always very skeptical about trying to compare between countries, because sometimes it might actually be beneficial for you to compare yourself against yourself. Because sometimes we can be very comfortable that we are doing better than the next person, but are we satisfied that this is where we are and this is where we should be? Sometimes it doesn't really quite help. We might need to look at it more. But when you look at where Uganda is, the level of informality is also a bit high. And that also has implications, for example, in terms of sustainability of any interventions that may be required to really be able to develop and support outcomes for children of Uganda. I think the previous speaker, Honorable, basically talked about the issue around inflationary pressures that we're actually beginning to see, not only in Uganda, but all over. And I think the biggest challenge that we're actually seeing in this case is mainly, with regards to, to food inflation, which is really peaking quite a lot. And I think at this point in time, yes, we've seen a tipping in terms of fuel, but food inflation is actually, quite high. And I think when you're trying to look then within the food basket, which are the commodities, I think at some point it was tomatoes that also, that were quite high. Maize, fresh beans as well, were also, showing that there was huge increases in terms of the prices. But that's really something that's of concern, because that the fact that we're really basically getting to a situation where food inflation is so high. Health, for some reason, I think, there's a bit of some stabilization in terms of the, inflation there. Right? But now, when we look at this situation, we also want to draw ourselves a little bit closer to how, for example, things are happening with regards to the resources that are being spent. So we just try to look briefly in terms of the spending within the current year, what exactly is happening on a broader scale. And I think we have seen, I think, a bit of some challenges since the beginning of the year in terms of, negative fiscal balances. We're actually basically at this point in time spending much more than actually is being collected. So when you look at the graph, at the bottom there, the red-orange line is basically showing the revenue, and then the one that's fluctuating is showing the changes in the expenditures. And what you are seeing is that when you look at the monthly, so this is basically information that's coming from the Ministry of Finance monthly reports, is basically showing that the revenues that are being collected on a monthly basis, they're largely flat. Nothing much is changing. But when you look at the expenditures, that are being incurred, they're actually much higher, which means we're basically, incurring, some deficits, because our revenues are basically less than the expenditures, except for the month of September. But, the situation could have been worse for the previous months. The reason why, for example, we are actually having that biggest deficit in October is because there were lots of expenditures that could have been incurred in the previous month since the beginning of the year that were then pushed into October. So that's why we have a huge bulge in expenditures against, more or less a constant constant amount of revenues that are being collected. Why are we saying this? Is because we really, I think, as children, also don't want to make very unrealistic demands without really looking at how we fit within the broader economy. So we are just, highlighting this so that, I think we are all, on the same page. Now, this is in terms of the number of poor people. I know that Uganda has really made a lot of progress with regards to poverty reduction in proportion terms, right? So when you look at the percentage, they're actually, going down. But because our population is also growing, when you look at the absolute numbers, of people that are actually poor, it has basically been kind of steadily increasing, because the rate at which the population is increasing is also much, much higher. When you look at this information, I think the previous speaker also mentioned something about the impact of COVID. So this is information from UBOS, which basically also showed that there was an impact in terms of the, the poverty, prevalence for, for the country in Uganda. Now, I'm also just going to speak briefly about this, which is the broader aspect in terms of, what is really happening on the population, because a lot of, some of the, I think, decline in progress is basically hinged to issues that have to do with the population. So the first graph, basically we just try to put two graphs that are showing, population estimates. So depending on who did the population estimates. So we have population from UBOS and UN in terms of the projected population growth. Basically, population growing at about 3.1%, mainly being driven by high fertility rate. 5.1 is high, fertility rate, for a country like Uganda. This has been mentioned before. Uganda is basically a very youthful population. So as we are planning, as we are making decisions, we are making decisions for more than half of the population, because more than 56% of the population is below 18 years. So that's also something that's really critical. But if we are to talk about the potential for a demographic dividend, we are looking at something that should be that graph, which is on the right there. But our population structure is a little bit different. So what we actually have is a huge dependence ratio, because there is less working people that are supporting a huge youthful population as well. Right, now just getting into a little bit of some specifics. And like I said, these are basically high level, and I think the panelists will also be able to unpack in terms of some of the nitty-gritties of what basically the situation is and what needs to be done. I've spoken about the decline in population proportion, in the proportion of poor people over the years, about 20.3%, down from about 37% in 2003. The previous speaker also mentioned something about multidimensional poverty, because that is monetary poverty. But what is actually, emerging right now is that I think this is, information that is coming, that multidimensional poverty might also be decreasing to about 44% from the 56%. But this is something that is still being worked on, and I think, the final numbers will basically confirm. But that is really, I think, quite positive in many different ways, because when you talk about multidimensional poverty, you're talking about deprivations in many different areas that include health, education, and so on. And I think the information that is coming is showing that there might be, a decline in multidimensional child poverty. Now, when you talk about children are part of a life continuum where there are different vulnerabilities that, that they face. And there are quite a number of them. So besides the many shocks that exist, issues that have to do with disability, we also have a lot of challenges that, for example, children face within the pregnancy or early stage, as well as the school age. And I think in terms of the interventions, when you look at the structure of Uganda, especially in terms of the social protection interventions, beyond the direct support that is basically coming within the UPE and USC grants, there is really not much that is happening in terms of direct support to, to some of those children, especially the pregnancy and early childhood stage. So that's also one of the key things and key vulnerabilities that children during that age may actually be facing quite a number of vulnerabilities, illness at that early age that might also need to be tackled on. But maybe more needs to be done around around that area. Now, just going a little bit into the specifics in terms of health. What is the situation? I think we still have a lot of children dying under 5 annually, about 46,000. And from what we hear from our colleagues in health, this is extremely high. I don't know whether it's me or other colleagues as well. Each time that I pass through for example, Mulago just opposite, where they sell coffins and so on. That moment when I see a very small coffin that is made, to be used to bury a baby, I get traumatized because I feel strongly that that should not happen. And I think every other effort needs to be taken to avoid that, because the moment that coffin is there, some other child somewhere is going to be carried and buried in that coffin. And I think it's something that also needs to, to be looked at in terms of what are the key things, what are the key drivers, what are the challenges. I think we've also had I think Uganda is one of the countries that really managed to do well in terms of maintaining, vaccination even during COVID. But I think there is a little bit of a decline, especially with regards to DTP, which declined. And I think it shouldn't be the case. We have to keep this very, as high as possible. Maternal mortality rate, 349 women per 1,000. No woman should die giving birth. Giving birth is not, personal duty, but I feel strongly that this is national duty. When you give birth to a child, you are giving birth to a resource that will really be able to take the country going forward. And we shouldn't get to a point where during that process, when a woman is giving birth, they actually lose their own lives. In the event, for example, that the child is able to survive that process as well, there are so many other challenges, shocks and deprivations that child is likely to face in future. They also have a right to have their own parent. But some of the causes and reasons why we still have mothers, dying in the process of giving birth is something that could really perhaps, be done. Something could be done about it. The situation could be managed, and we could actually even try to reduce, these rates so that we save our mothers, our sisters, and so on. Children on ARVs, 68%, the target would really be 90 in terms of coverage. But if we're still below that level of coverage, it means there are still a lot of children that should actually, be getting services that are actually not even getting, not be getting them. So it's also one of the key things that we also need to look at as we're talking about children, how we're going to be supporting, how do our future plans, how do our next, resource plans also relate to this situation. So it would also be critical. 39% of under 6 not exclusively breastfed. I think men and women alike, I think there's really been a lot of awareness that has been raised with regards to the benefits of exclusive breastfeeding within the first 6 months. But we still have a challenge. More than half, it's slightly, this is 39% not fed. So this is actually something that we need to, to also look at in terms of how do we improve, what sort of investments would be necessary, because once you do this, you're actually putting a child through exclusive breastfeeding on a better footing for them to be able to develop better mentally and any other aptitudes that they're actually expected to be developing over the process of their life cycle. So if it's not done, that's also a little bit of a challenge. 11% of the 6 to 23-year-olds, minimum dietary diversity, which means there is a problem there with regards to nutrition. 1 in 3 children is stunted, 29% stunting rate. Chronic food insecurity in some parts of the country. So those are some of the challenges that we're talking about. 46% of health facilities without wash services. When speaking to those colleagues in health, I'm pretty sure that we also have colleagues in health in this room that will be able to explain to you how important water it is in a health facility, in terms of infection prevention and so on. And I think when you have a situation where less than half of health facilities have proper wash facilities that will be able to help, with regards to provision of clean water, that's a huge challenge. What is the problem? And then now when you try to look, for example, on the other side, when you look at the neonatal, it must be the neonatal rate, right? It's actually not improving. And much of I think the discussion that is happening is that a lot of it perhaps also has to do with, infection control within health facilities, that children get to pick some of these within the health facilities, mostly attributed to issues that have to do with lack of wash facilities. Now, just trying to speak briefly in terms of the situation, because now we're talking about health, because human resources for health is a very critical ingredient. We might have as many, medicines as possible, as many facilities as possible, but the challenge always comes in with regards to the issues that have to do with human resources for health. And here I just want to draw your attention to health center tools, because that's where there's a bit of a problem with regards to availability of staff. There's a challenge there. And health center tools are a critical part of the primary health care delivery. And if we don't have for example, adequate staffing at that level, that is actually a little bit of a challenge in terms of how, services actually, being provided, being, being provided. So when you look at the graph below, in terms of the head count, it's also actually very, very high in terms of posts that are actually unfilled. So that's one of the key challenges. Now, but at some point, what was also interesting is that when I looked at because this is 2020 data in terms of staffing at the Ministry of Health headquarters as well as the regional referral hospitals, there was a time, I think this must be 2017-18, when at the Ministry of Health there was actually overstaffing. But during the same time, we actually had a problem with regards to Health Center 2 staffing situation. So the staffing situation is critical for primary healthcare delivery. When it comes to, I think we also have this slide which is talking about malnutrition, one big problem. And I think what we try to do there is to put a bit of some information with regards to the malnutrition situation. 19% increase in the number of children admitted in health facilities nationwide to be treated for severe acute malnutrition. So 1 in 5, right, increase in the number of children being treated for severe acute malnutrition. I think this is something that perhaps in Uganda we really have to look at quite seriously. I know that the panelists will also be able to touch on some of the challenges that are related to nutrition in Uganda, and one of the key things that perhaps we need to do in terms of trying to resolve that situation. 10% increase in newborn deaths nationwide in 21-22 compared to 2020-21. So newborn deaths increased at least up to now, 2021-22, 10% increase in newborn deaths in that financial year. So we continue losing children. And the rate of the increase is actually quite high, because 10% increase in deaths of newborn is not a joke. While we are saying no child should die, this is something that is actually happening during our lifetime. Right, talking about education, a bit of some efficiency issues that perhaps need to be looked at. I'm looking at my colleague Nabendra here. I know he always speaks quite passionately, with regards to issues that have, to do with education. So when you look at, in terms of the percentage of children aged 8 who could not read, look at the increase. Between 2018, there was only just 1 in 3. But now, half of children below the age of 8 actually have problems with reading. So that's quite a big challenge. Where are those children going? And then from here, going forward, what are we going to do? What kind of society are we actually building in this case? So I think it's also one of the things that we also need to look at, I think, quite critically. Only 32% complete primary education in 7 years. Perhaps some take more. Some of them might not even finish. Transition from primary to secondary still remains quite low, 69%. So this is like 2 in 3. Where do the rest go? Where do the rest end up? What kind of citizens are they going to become? Because when they only just complete, there is a lot of loss that is already happening at primary level, but then transition into secondary is also quite low. 2 in 3, in every 3, only transition to secondary. The net enrollment rates, I think I will not spend a lot of time around that. Widening disparities in terms of pre-primary attendance, Karamoja 38%, and then about 38%, and then it's actually even lower for Karamoja, about 16%. So less than 1 in 5 children in Karamoja actually attend pre-primary. Primary attendance ratio, also quite low in places like Karamoja, 88% in Kampala. So those disparities geographically. So what we would need to do is we're actually making our efforts to be able to support in terms of primary attendance or issues that have to do with pre-primary. We also have to be much more focused in terms of the areas that we would need to look at. Only 9% of children with disabilities enrolling in primary, and only 6% finish. There is a bit of a challenge there that we also need to look at quite critically, because once there's a lot of leakage in terms of these children, already they are facing a lot of challenges in terms of access to education. But then if they start and then they also then don't finish, that's also a little bit of a a bit of a challenge as well that needs to be looked at. School financing remains quite a big challenge. For Uganda, I think we also have a challenge with regards to the per capita allocations. Are they adequate to really be able to support, schools to be able to provide the best quality of education? Maybe there's also a little bit of a challenge. Huge classrooms, they're also a big issue, which is something that perhaps has to do with the number of schools that are available, but also the number of teachers as well that are available to be providing that services. In terms of movement of the curriculum, I know that there are reforms. My colleague Nabendra would speak better about this in terms of trying to modernize the curriculum. I think it's also one of the areas that perhaps needs to be looked at in terms of trying to ensure that it also takes into account some of the key targets in terms of modernization of education in the country. I want to speak there about two or three graphs, especially in terms of what is happening in education. So what we did in this graph is trying to look at the data, official data around the enrollment rates in education, which children, how many children are in school and so on and so forth. In this case, we're talking about the gross enrollment rate. We then tried to put together the population estimates, the population projections from the 2012 census going up to 2030. And then we tried to look at each and every age category to see how many children are within this age category and at what level, if they are supposed to be in school, should they be. So when you look at those numbers, that are potentially from the population supposed to be in school, I think it's up to about 18 years. This is what is showing in the green line, right? And then the blue line is showing those children that are actually enrolled in school. So what that is showing is that before we even start talking about those children that are in school and whether they are completing, there are already a huge number of children that are actually structurally out of school. So this is official population in terms of those children that are supposed to be, of school-going age, and then those that are actually in school. There's a huge difference already, and that's really quite huge because in terms of the population statistics, there's about 20 million, yet there are just about 11 million that are basically in school at that for 2022. So structurally, I think there's something that we also need to look at quite critically there because this is a problem. If we come back to ECD, because this is one of the main areas, that also needs to be looked at. So in this case, this is with regards to, attendance to preschool, pre-primary school. Also a huge challenge because when you look at those, officially, the figures that are available with regards to the children that are attending pre-primary, and those that should be, in pre-primary, structurally, a lot of children are basically left out. So even as we are focusing on the challenge of those that are in school, to retain them, ensure that they learn and they're able to develop, there's a lot of exclusion. And what we need to do as a strategy is to devise how we can actually be able to get those children structurally left out of school, for whatever reasons, to actually be getting to school. This one, is talking about, secondary, same problem again. When you look at the numbers that are enrolled, gross enrollment ratio, and those children of school-going age, huge challenge with regards to structural, exclusion of children from school. We have a bit of some issues with regards to protecting the rights of children as well. Birth registration, I think this still remains a huge challenge. And this doesn't only, pertain to children, but I think there are also other issues that have to do with national registration and the reforms that NIRA is doing, what NIRA is trying to do to roll out the national registration. But when a child does not have access to a birth certificate, there are so many other things that perhaps they will not really be able to have access to. 1 in 4 of 15 to 19-year-old have begun childbearing. I think we've spoken about issues to do with teenage pregnancy. I know this will be discussed perhaps further within the panel, but I think the previous speakers also, including the facilitator, mentioned issues that have to do with teenage pregnancy. Huge challenge. And I must say that when you look at the data going backwards, it's not an issue that only came because of COVID. There's always been a problem of teenage pregnancy, in the country. And I think what is necessary is perhaps COVID really brought this more attention for people to discuss openly about it, and perhaps also start thinking about what perhaps needs to be done, about this issue. There's the problem around children, street children as well. About 16 children coming to Kampala streets every day. This is data, I think, from our own colleagues in child protection. So that's also, I think, one of the other challenges that we need to also be trying to look at. So this is what, children basically find themselves in terms of the, in terms of the situation. Gender-based violence was already high before COVID. Before COVID, and it still remains quite high. So when you look at the data that is coming from the health facilities, it's showing that, of course, there might have been a decline between 2015 and 2019, but it's still very, very high in terms of the gender-based violence cases. And when you try to look at those that impact on children, we basically try to look at, three things. One, defilement. I think we have domestic violence and child neglect. We have a problem with regards to defilement cases. This is a huge challenge. It's so this is data from, from the police report, the annual reports. This is a huge challenge, especially, for, in 2015. Yes, there might have been a decline, but generally over the years, when you look at the number of cases reported, defilement is a big issue. And much of this basically involves children. And a lot of effort perhaps needs to be done for us to be able to protect those children from, from some of these cases. Climate change, I think we have seen quite a number of things. These are shocks that, sometimes come through with the locusts, issues of floods, with the problems around malnutrition, as, some of the challenges that are also coming because, the droughts also impact in terms of the food security. So it's also, I think, some of the things that are, that children today are basically facing. And I think as we're actually planning, we also need to be looking at this quite closely and say, how do we build resilience so that our children can actually be able to, to enjoy their rights in this case? This is just a snapshot in terms of what we've been doing. So I've now just taken a slide that is showing in terms of the financing situation, that when you look at access to health, this is just as a typical example. We've basically remained flat in terms of the amount. Yes, there's been a bit of an increase in terms of amount of money that is being allocated to health. But in proportion terms, this has basically remained very, very, constant at just about 7 point something percent. There's really not been a huge challenge. And what we are saying there when we're calculating those proportions is basically that, we are taking into account the entire resource envelope. I know that the percentages will be different if somebody only looks at the discretionary allocations, but that's also, I think, one of the key challenges. And I think it really takes Uganda in a very interesting situation where I think if we compare to other countries within the region, I think this data is for 2020-21. We're actually quite low. And then when we try to look then, because what is of importance, especially for health, is the primary healthcare system. Because no matter how much you invest in health at whatever level, if your primary healthcare system is not functioning, forget about reaping the gains. You will still be seeing queues and queues in Mulago, in Naguru, in all the referral hospitals, if your health center 2s, health center 3s are not working. So what we try to do here is that trying to look at the budget call circular issued by the Minister of Finance this year, we're actually seeing a big challenge with regards to primary healthcare financing. There is actually a projected decline if the figures that are included in the budget call circular were to be approved today, because there is a huge decline in terms of the amount of money that is going to districts for spending within the primary healthcare system. And I think the graph to the left there is showing some of the districts. And I think the cuts will actually be very serious in Mitoma district. 61% decline in health budget for Mitoma district. I don't know what is informing this, but I think this is one of the key things that are really, I think, concerning for us, because we also need to be, I think, looking at this very closely. I think we have a full report that we can share with colleagues that basically talks about this. So in terms of the districts, I think a total of about 117 districts and municipalities who are actually projected for declines in their primary healthcare budget. So it's 117 because the vote system also, some districts have municipalities and rural districts. So when you split them, there are about 176 votes that pertain to primary healthcare system. 117 of those districts and municipalities are projected for declines. And when you go further to look at that situation, you actually realize that those primary healthcare facilities that are owned by the government are the ones where those declines are actually, projected. So the private not-for-profit, so those that are owned by churches, there's kind of maintaining of the status with regards to financing for health. But that's really concerning. I think it's something that we need to be discussing much more as we're actually looking at discussing the framework paper with the parliamentarians here, that we look closely and see how we can actually be able to preserve, at least for primary health care, because that's really, quite important. Education, also I think in terms of the total allocation, just about 8.6%, Uganda lagging quite behind. But I think what is also important in this case is we also try to look at the core secular again, to look at what is happening in terms of allocations to districts, education districts. So we also have some districts that are actually registering as much as almost 1%. Education is not really much, but there's quite a number of districts where declines are actually projected for financing for education. But in this case, in this situation where I think the classrooms have become bigger, especially for the first grades and early grades, because of the 2 years, that we're actually behind. We should actually be seeing, I think, much more basically going towards supporting education at that level. But if we are seeing declines, I think that should also be something that has to concern us. So there is also a report. I will not get too much into the details around, around this as well. Then I think just to try and sum up in terms of some of the things that we need to look at. From our perspective, if we are going to be able to have a population that is healthy, children that are going to, to grow well and reduce the burden of diseases later in their lives, we need to make a lot of investments in primary healthcare system. One, we are going to prevent a lot of things. We are going to be able to reduce congestion, for example, at higher levels of, health facilities, but also because these facilities are closer to the communities, they are actually able to provide better services than if the same communities were to go to a higher level to access, access these services. So I think that issue around investment in primary healthcare would definitely be important. There is the issue around the social service workforce within the communities. I perhaps would anticipate that this will also be discussed within the panels. That we have social workers that are employed by the government, but one, they are not enough. These are the people that are responsible for tracing the cases within the community, the defilement cases. How do you resolve those issues? How do you identify GBV cases? How do you resolve them? And how do you support the victims? But I think there is a huge issue that is happening with regards to, one, the numbers, but also the capacity of those people. And I remember, attending a certain discussion, I think some 3-4 months ago, where there was basically, I think, a certain case where the alleged perpetrator was actually taking responsibility for going to pick the police to investigate a case where they are the subject of investigation. Can you imagine what could happen, in that situation? So I think there is also that issue around resourcing of that, at that level. Bottlenecks in the education system could also be, avoided, I think, if we invest more in ECD and ECE, because we're going to have children, perhaps, that will go to school when they are ready. You avoid repetition. You can also potentially avoid the big classes as well. So that's something that is also a bit of something that we might also need to look at. There's the issue around malnutrition and stunting, which is a challenge. If you remember, 1 in 3 children is actually stunted. And I think if we're able to, do something around stunting, in Uganda, I think we'll be able to, avoid a lot of challenges, because a child who is stunted cannot develop better physically, mentally. And their potential to be able to be useful citizens in future can actually be reduced because they really didn't have a strong, upbringing in their early ages. So this is what I have for now. I hope this was useful. Just as a high level, I think, summary of what we see as the situation of children. So thank you very much. Hand back to the facilitator.
Thank you very much, Tawanda, for giving us that very, very insightful report. And if you did miss out on any things that are coming through, I saw something that was highlighted, 16 new children coming to Kampala streets every day. I ask, where are they coming from? Who is bringing them? What are the push and the pull factors? Because if we're talking about street children, there are always the pull factors and the push factors as well. Those are key aspects that we need to be looking at. And if we go ahead to look at 46,000 children under the age of 5 dying annually due to preventable diseases, it's absurd. Because if they're preventable, that means they can actually be dealt with and these lives can be saved. And I think Tawanda, I totally agree with you. I think I share in the same pain when you're going past Mulago Hospital and you see those small, tiny coffins for babies, and you're thinking, okay, yes, they're looking for the next business, but that next business is the pain of a parent who is losing a child, which is very, very unfortunate. So I still go back to the questions: what are the costs of inaction? That is something that we all need to pay attention to. And without any further ado, ladies and gentlemen, allow me invite for a presentation on how we can do better for the children. I love this particular one because then we are moving from reading the book of Lamentations in the Bible to the book of Acts now, right? So we move from Lamentations to Acts, and allow me invite Madame Doya Alice, who will also be in part presenting with Dr. Enid Mbabazi on this aspect. Let's welcome Madame Alice to give us an overview of what we are planning to do better, the positive, and how we are going to be able to achieve the demographic dividend that we always seek to achieve.
Ladies and gentlemen, my name is Alice Doya. I work with the Prime Minister's Delivery Unit as head of the thematic area of education, and I'm here to specifically address myself on issues that can be handled to enable our children who lost a lot during the school closures this time round. My presentation is projected, but for slides 1 to 3 is about information. I wouldn't like to dwell on them, but what we know is that schools were closed, our children lost a lot. In Uganda, schools were closed to close to 2 years. Government of Uganda did a lot. Government of Uganda did a lot to put a recovery plan, and we, up to now, children have not revived from the loss. We tried to do broadcasts on phones, on radios, on TVs, but because of issues of connectivity and lack of MBs by parents, some of the children missed out. There was phased comeback. P7 came back, P6 came back, P5, P4 came back, but this was not all embracing. Classes P1 to P3 did not benefit from this. They were left behind. I am considering the primary school level. Ladies and gentlemen, this is what was done in order to accelerate education, to accelerate learning, to do catch-up remedials and bridging programs. All this was done by government, and we offered special funding for development of standard operating procedures. Yes, districts and schools were guided on the management of the spread of the infection. Education stakeholders were trained on how to comply with SOPs. Procurement and distribution of face masks to learners was done by the Ministry of Health. Developing strategies on decongesting and promoting social distancing in offices was done. There was a development of robust curriculum recovery plan and plans to manage examinations and related activities by distribution of home study materials. This was done through the office of the RDCs across districts through the sub-counties and LC ones, but they were inadequate. Curriculum coverage was low. There was lack of supervision. Monitoring was not done. And looking at the level of education for the parents, they were not able to guide the children to go through and use them to bridge what they had lost. There was promotion of sanitation and ensuring safe and hygienic school environments through facelifts when we had just thought of total opening. The Minister of Education and Sports ordered a facelift of all school facilities which had been closed for close to 2 years. Some of them were deadly dilapidated. The desks had been used by communities in funerals and many parties, and they were not in schools. Mass vaccination for health workers also included teachers. There was a special way of vaccinating teachers at all levels, and we have seen provision of psychosocial support services for learners and staff, and this has done by many of our partners. I'm conversant of BRAC, conversant of ISA, I'm conversant of STAR Education. They have done a lot to help us do this. There was support to catch up with the lost time through face-to-face when full opening was done, provision of education resources in different formats, such as electronic and hard copies, and measures to use in monitoring the use. Collaboration between the Ministry of Education and Sports, educational stakeholders, social partners, and parastatal bodies was done. His Excellency, the President of the Republic of Uganda, developed a coordinated communication strategy to avoid contradictions when speaking to parents, teachers, and learners. Time and again, he addressed the nation, gave us the risks, and gave us the way to protect ourselves. Use of extra lessons to make up for lost time, teaching time during disruptions was also done, and parental support and guidance to enhance support to their children was also done. Phased return to schools, I earlier mentioned, this involved allowing few learners at school for specific periods. Primary 7 came in first for 1 month, Primary 6 came in second for another month, Primary 5 and 4 came in third for 1 month. Lessons were broadcast, as I earlier mentioned, and the focus was on grades that were at home other than those that had been returned back to school. However, this phased return was not all embracing, like I mentioned in the introduction. Primary 1 to 3 did not seize this opportunity. The focus was on grades that were at home other than those that had returned to school. However, this phased return was not all embracing for Primary 1 to P3, and it did not seize this opportunity. Lessons broadcast had challenges of interconnectivity, unstable internet, unaffordable Wi-Fi charges, and lack of ICT infrastructure. The Ugandan government adopted strategies that focused on curriculum interventions so that teaching and learning support that needed to be provided to the teacher and the learner was prioritized at the full return to schools. The provision and facilitation of both individual and group-based support, especially the vulnerable students, girls, and learners with special needs regarding their studies, counseling was very important. What can we do better? We gave the hard copies of study materials. We broadcasted lessons on TVs, on radios, on phones. There was even Zoom learning for the private schools, but still the children lost. What can we do better? Can we borrow from our neighbors? Can we borrow from Kenya? In Kenya, we can borrow the 4-term model, which has enabled their learners to recover the lost time. Before the onset of COVID-19 pandemic, Kenya had a well-structured system of education. The primary and secondary school calendar ran from January to December. the terms comprised of 3 months, and full learning, and a month in between for breaks. The syllabi were structured to be covered in the 9 months at most. During the 1 month break, both teachers and learners would seize the opportunity to rest and refreshing before getting back to another engaging 3 months. This table shows the structured system of Kenya. Unlike Uganda, Kenya did not do automatic promotion. For us, when we fully opened, we massively promoted the learners. The learner who did 2 weeks in P1, when we opened, that learner was promoted to P2. The one who had not done any P2 was promoted to P3. That was not the case with Kenya. With Kenya, the students started where the lockdown met them. And what they did is to create a 4th term in an academic year. From the normal 3 terms in a year, they created a 4th term. And in that intervention, they had a child doing P2 work for 3 terms. And in the 4th term, I'm going to restrict, they start P3 work. They use 2 terms in year 2 for completing P3 work. They go to the same year, they use 2 terms to do P4 work. And when they enter 3rd year, they normalize and go back to the structure of 3 terms in an academic year. And there, their children have really recovered the lost teaching time. In Uganda, we can copy. This is the illustration I was talking about. In year 1, the learner uses 3 terms, i.e. term 1 and term 2 and term 3 to study the content of primary 2, for example, and then term 4 of year 1 is used for starting primary 3 work. Then when we go to year 2, the learner uses 2 terms, term 1 and term 2, to complete the content of primary 3, then term 3 and term 4 of year 2 for starting on primary 4 work. Then in year 3, the learner uses term 1 to complete the content of primary 4, and then terms 2 to 4, that is term 2, term 3, and term 4 of year 3 are used for doing the entire primary 5 curriculum. By the end of year 3, the 3-term structure model will have normalized to the ordinary status quo, where learners will be able to do a given grade in 1 academic year of 3 terms. I propose that we take on that model. For example, our children did 2 weeks in P1 and they were promoted to P2, which means they missed on the content of P1. In P2, these children who missed P1, they are now in P3. Let them use the 4-term model, and in term 1 of P3, let them do regaining of learning. Regaining of learning is represented by RL. They regain literacy, they regain numeracy, and other basic learning areas. In term 1, they are meeting. That's the illustration. In term 1, the P3 child is meeting the P1 teacher on the selected missed topic in the primary 1 curriculum. Still in P1, this P3 child is meeting the P2 teacher in that created term X or term 4 to do revision exercises for primary 2 curriculum to regain literacy, to regain numeracy, and other learning areas. Then terms 2 and 4, 2 to 4, term 1, term 2, term 3, and 4 are used to teach the whole primary 3 curriculum. That is our illustration. This child is now in primary 3 in term 1 to regain literacy and numeracy and other learning areas. Will meet the P1 teacher which he missed and do selected subjects. Then also meet the P2 teacher to revise those basic areas that he requires to move efficiently and confidently to do the P3 work. We shall use term 1 for remediation, bridging and catch-up on missed class selected content, previous class revision areas. This will be purposed for regaining literacy, numeracy, and other learning areas. I have passed through that illustration. What will be the roadmap? This will be our roadmap. We are going to engage in research on the school curriculum at all levels for selected topics in which pupils struggle and are underachieving in the classes that they are in. It will need expertise from NCDC, from PMDU, from Ministry of Education, from Ministry of Education and Sports, from Ministry of Health, from other agencies like DES and UNEP, and we shall need the NAPE results. These children lost out and did PLE in 2021, and we called it PLE 2020. We would like to research and see, after the loss and the closure for close to 2 years, when these children did the PLE 2020, what are those areas where they struggled? What are those areas where they underachieved? We shall use even the NAPE results. NAPE goes on to identify the subjects and the topics and the concepts that were not well done in PLE. We shall look at those. Then we do a sample of 500 schools around the nation. We shall do 150 best performing schools, 150 middle rated schools, 100 schools from remote areas, 100 private schools, and we use our friends, the users, the consumers of education, to tell us how much they are struggling, to tell us where the issues are, even to advise us what they feel we can do better to make them go back to the rail. This mode will help the learners move forward efficiently with the revised curriculum. Government will be enabled to solve the automatic promotion crisis, where a child who was in P1 for 1 week is now in P3, missed the entire P1. The education system will normalize at given levels in the long run, and this model will serve as a disaster reference in the future in case we get another problem. Monitoring. The use of monitoring of learners to assess their progress and subsequent facilitation of the appropriate intervention continues to be undertaken as and when needed. On an administrative approach, this will lead to the adoption of new educational policies and regulations such as adjustment of the academic timetable, use of new teaching programs, model of delivery, promotion of catch-up programs within the curriculum, maintain health and safety measures, and use of financial relief packages by government from the Ministry of Education and Sports. Empowerment. My request to UNICEF is that they enable the formidable team of PMDU to catalyze the recovery of lost time through this intervention. All the above will be attained very well if PMDU-OPM is placed in the lead of steering the above proposal for God and my country.
And ladies and gentlemen, as Dr. Enid comes through, as the presentation did come through from Madame Alice Doya, we were joined by our chief guest, who is also the Right Honorable Minister for General Duties under the Office of the Prime Minister, Right Honorable Justine Kasule Lumumba, who will just stand and wave to us. Thank you so much, ma'am, for sparing time off your very busy schedule to come to us as we speak about children. And we were reminded that each one of us here is a child, because you have a parent somewhere. Yes, each one of us has a parent somewhere, and your mom or dad refers to you as my child. It doesn't matter what age you are. So we, as you came in, Right Honorable, we were looking at a presentation on how we can do better for the children in Uganda after realizing the very many problems that are existent. And allow me invite Dr. Enid to come and conclude this before we go to our panel discussion.
Thank you very much, moderator. honorable ministers, members of parliament, the country manager UNICEF, and UNICEF staff, my colleagues, staff of the OPM, ladies and gentlemen, good afternoon. My name is Enid Mbabazi, as already introduced, and I head the thematic team of health in the Prime Minister's Delivery Unit. And this is going to be the outline of my presentation. We are going to talk about how prepared and resilient our health care system is. Just to bring us, to put us into context with regard to today's theme, we shall look at the key health-related challenges that are associated with the COVID-19 pandemic, the direct and indirect effects of the COVID-19 pandemic on children, and we shall also reflect on what does recovery post-COVID look like. Do we want to go back to the previous state? Are we better? And then lastly, we shall look at the proposed actions. Next slide. Next slide, please. Okay, so just to give us a brief background, there are a number of challenges within the health sector, and the previous speakers alluded to some of these. Uganda has a rapidly growing non-communicable disease burden. Although there's been a reduction in maternal and child health over the years, the communicable and nutritional conditions of our citizens has not improved much, and we still have a burden of these communicable diseases, and also the problem of persistent endemic infections such as malaria and respiratory diseases that really affect our children. And here I'm referring to the young ones, not us, the old ones. We have issues of emerging and re-emerging diseases and epidemics, and right now we are battling the Ebola epidemic. We are still in the COVID-19 pandemic, although the numbers have really reduced. Next slide. Oh, thank you so much. Okay, I will not go into the definitions of resilience, but we know that it is a process of really being able to adapt well and bounce back quickly in times of stress. And I want us to look at how prepared and resilient our health system is. And Uganda, like many other countries in Africa, faces many complex challenges. And these are interconnected and continue to drive health outcomes. And most of them are actually beyond the health sector. And these include poverty. I think the presenter from UNICEF did allude to this. Rapid urbanization. Those of us who live in Kampala and the other emerging cities and municipalities, you know what I mean. Climate change, this is a topical issue these days. Air pollution, no need to explain this. Environmental degradation, this is a serious concern globally. Rapid population growth, somebody talked about population pyramid, which is bottom heavy, Migration and disasters, to mention but a few. With regard to our system resilience and preparedness, and it is important for us to discuss this given the frequent emergencies and the shocks to the health system that we have experienced. The COVID-19 pandemic and the current Ebola outbreak. I will not go through this contextual, conceptual framework, but we shall share this presentation for us to be able to appreciate what I'm talking about. We will look at resilience. I'm sorry to really dwell on this background, but when it comes to the effects, we shall be able to put them into context. Absorptive capacity, which is basically the continuity of health services at the same level in terms of quantity, quality, and equity, despite the shocks or the stresses, using the same level of resources and capacities. And again, I'll be referring to the presentations to the presenters that have already spoken. We did allude to the resources that are mainly allocated to the key sectors. Adaptive capacity is adaptations to deliver the same level of healthcare services with few and or different resources. And here are examples of adaptation of delivery models in the COVID response that I can quickly remember. There was client and community-centered approaches that were implemented to mitigate the effect of COVID-19, and there was online support mechanisms to the clients and the health service providers. Most of the trainings were done online, and also other support. Transformative capacity. This is ability to transform the functions and structure of the health system to be able to respond to changing environment, or to be able to adapt to stressful situations. Leadership, innovation, creativity is key. At individual level, we need the tools, we need the protocols, and the system to be able to quickly adapt. Still on our health system resilience, we all know that we have had challenges with our system. It is not well equipped, that is a fact, to address the growing and persistent infectious disease burden. There's a lot of public outcry there, and the families spend a lot from their pockets to really access health care. Although we have progressively improved, there are still gaps in preparedness and response to health emergencies, and we saw that we witnessed this during the peak of the COVID pandemic, whereby there was interruption in the continuity of services, of basic services. Mitigation of the socio-economic impact of COVID-19 has become very significant, and the previous speakers have alluded to this. let's talk about the challenges that are associated with the COVID-19 pandemic, and these have really been talked about in a number of fora, including the previous presenters, so I will not dwell on this. My colleague Alice has talked about the prolonged lockdown and closure of schools. This was really a key challenge, and we all know that schools play a useful role in promoting the importance of personal hygiene, promoting physical activity, healthy feeding, although of course the learners complain that sometimes the meals become, monotonous, but we know that posho and beans and rice are good for our children. Body feeding and body habits, as already talked about. Home captivity for children affected their physical and mental health as a result of the prolonged lockdown. And here we are looking at the consequences or the manifestations of the captivity and the effect that it had on the physical and mental health. We've seen childhood obesity on the increase, and some of you can bear me witness that your children really put on a lot of weight during lockdown, which is really not good for their health. There was reduced cardiorespiratory activity because of them being confined in the same place for a long time. Irregular sleep patterns. This was experienced particularly in children who would spend most of the time on their phones, on computers, and they would have problems with sleep. And favorable diets, because at home there's really access to some of the junk foods, and which is really unhealthy. And I've already talked about the long smartphone use and the time that the children were spending on our screens. These really have negative implications on the health of these children, and studies are yet to be done to be able to identify the long-term specific health impacts. Challenges with children's physical and mental health also included frustrations. We saw many of the children get frustrated. Some parents also got frustrated and were complaining about the prolonged closure of schools. They really wanted these children back in school. There was insufficient information. We all know that a school is really one of the great avenues where our children get basic information, and with school closure there was really an information gap, lack of in-person contact with their peers and teachers, and actually some of the children really complained a lot about missing their teachers and their peers. Lack of personal space at home. Some of this has already been alluded to. Most of us were not used to spending time with our family. There were issues with husbands and children, and parents and children, and the financial burden on parents, which often is unnoticed and forsaken when the children are in school. Parents were complaining that they were spending a lot on feeding the children. They were using a lot of there are things that I don't want to mention. Somebody said the water bill increased because of increased flushing of those places of emergency. And the complex play between psychosocial stress and the pandemic-induced homestay and lifestyle modifications, I'm very sure will further worsen the effects on a child's overall health and in a vicious cycle manner. And where it's just a matter of time, we'll be seeing all this. There's increased violence against children. This has already been alluded to. Child abuse, child neglect, domestic violence, teenage promiscuity. You can imagine. These schools, by the way, are considered as safe places for children, but when they're out there at home and they're doing errands, they meet lots of people, you know, from different backgrounds, and some of them end up being abused. For instance, girl children who go to fetch water, especially in rural areas where water is very scarce and there are long waiting lines, they end up engaging in relationships, and sometimes they are actually taken advantage of by older men. Dropout from formal education has already been talked about. Indulgence in high-risk activities. You'll agree with me when you move in the evening along Kampala streets, you see these little children vending. And actually, some of them have refused to go back to school because they are looking at the short-term, the low-hanging fruit, that the little money that they are getting from vending. But that kind of activity is really not safe for these children. We've seen the proliferation of child labor. Some of them have actually, quite a number have dropped out of school, and they are engaged in child labor. So both direct and passive exposure of the children to abuse, psychological aggression, and physical punishment by caregivers leave permanent wounds in the form of impaired development of the brain and psyche, high rates of psychosomatic and these are technical terms, neuropsychiatric disorders, multiple substance abuse, and suicide thoughts. I actually wanted to raise this issue. We have young girls who have come to give their testimonies, and thanks to the organizers of this dialogue, but I've not seen the boys. The boys were equally affected, and we need to hear testimonies from them. Special groups who include the poor, like the children living in slum areas, the refugees in refugee settlements, migrants, and internally displaced children. These are very special because of their vulnerability. They are deprived, and they have deprived and endangered childhood health and financial issues, including inequity, which really puts them at the risk of contracting and propagating COVID-19. Like I said, we are yet to control COVID and declare Uganda COVID-free, but we all know what is happening in other countries like China. Cases are really on the increase, and they are going into the lockdowns again. And when these children do not access good care, these special children, then they have high levels of mortality, and they cannot sustain their needs. Children living in detention facilities, immigrant camps, orphanages, in most cases have no arrangement for safe drinking water, food. There are lots of sanitation barriers and also poor access to medical services. Again, my colleague from UNICEF alluded to this. And we know that some of these diseases that we are experiencing, the Ebola, the COVID-19, they are actually hygiene related. And good hygiene practices are very, very important. So you can imagine in these settlements where there's no access to those facilities, that makes them really vulnerable. Basic preventive strategies such as frequent hand washing, which I've already alluded to, physical distancing, they are virtually unattainable in these settings. The other challenge that I would like to talk about is disruptions in essential and quality health services. The nationwide strict lockdown, we all know that, affected continuity of services because of restrictions in movement. Children were unable to visit their pediatricians. There were those who had mental. I'm talking in the past because we know that the numbers these days are very few. So all these were experienced at the peak of the pandemic. They were unable to visit counselors and to receive support from psychiatrists. And also we witnessed interrupted supply in medications, especially for children who have got to take medication on a daily basis, like children who are diabetic, children who have respiratory problems like asthma. They were not able to access health care, and that actually led to worsening in their conditions. And we also recognize that while periods of lockdown initially provided a golden opportunity for parents to mingle with their children, and we saw all kinds of, posts on social media, what was happening in homes. However, the frontline COVID warriors, who include the nurses and other responders, were time poor, tireless, and hard-pressed. They hardly found any time for their family and children, and you can imagine the implications of this. Some had fear and guilt of contamination by the virus to their little ones, and they actually preferred to stay away from home. And in developing countries, they would actually require people who are working in ICUs to stay away from home for long periods of time. So you can imagine if you have young ones in your home, you say you're a breastfeeding mother, and you have maybe a child with a chronic sickness, and you've got to stay away from home for long periods of time. Loss of jobs by parents. Previous speakers have already alluded to this, led to evictions. We saw some people being evicted from their homes. We saw people grabbing land, and failure to provide food. There are people who are going hungry for a week, and I would like to really appreciate the Office of the Prime Minister for coming in to rescue some of these families, but we do recognize that this support was not very sufficient. And of course, the consequences like anger. People became so angry. they were aggrieved and generalized disregard for society, and then with consequent adolescent physical, mental, sexual, and reproductive health problems. And again here, a lot has been talked about the girl child, but we also need to reflect on the problems that our boy children are facing. Restrained access to basic health care and mental health care. This manifested in form of reductions in uptake of child immunization services. My colleague from UNICEF again showed us the graphs. Maternal health care was disrupted, sexual reproductive health services, and this ultimately led to an upsurge of unmet need for family planning and inappropriate contraception. Some actually were improvising due to lack of contraceptive supplies, which resulted into teenage pregnancies or child pregnancies, unsafe abortions, unplanned pregnancies, increased rate of sexually transmitted infections, and the list is endless. The supply of essential drugs, I've already mentioned children with diabetes who really rely on insulin. They were unable to access this during And children with HIV also were not getting their antiretrovirals, some actually, although efforts were made to make sure that people get refills at home. So you can imagine a child missing their antiretroviral treatment at that formative stage. And the experience from the Ebola outbreak, the current one, has really taught us that severely limited access to basic health care would lead to the spread of COVID-19 and other non-COVID diseases of public health importance. I'm going to try to rush through the slides. Here is an illustration of the decline in the uptake of immunization services during the pandemic. I've highlighted in red the numbers during lockdown, and we can appreciate the 21% reduction during that peak of the COVID-19 pandemic. And globally, the largest sustained decline in childhood vaccinations in approximately 30 years was recorded during COVID-19, and this data is available. It was published by UNICEF and the WHO last week on the 15th of July, and it's available. You can Google and look at the report. And there's a measure, the indicator for immunization coverage, the universal one, DPT-3, and it really fell significantly. And I'll straight away go to what I've highlighted in green. Uganda was able to hold off the declines, and we actually maintained high levels of immunization, of routine immunization program coverage, while we rolled out a targeted COVID-19 vaccination program to protect the priority populations, including the migrant workers. So this is very good news for our country, that although we experienced that decline during the peak of the COVID-19 pandemic, we were able to really recover. And that report actually shows that Uganda and Pakistan are the only countries that sustained the gains in immunization, that caught up. And that was, for us, for our case, it was because the COVID, the response, the COVID response had inbuilt interventions to mitigate the declines in immunization coverage, and they are highlighted there. Effects on children. I've been presenting on challenges, but I'll quickly run through the effects. They are direct and indirect. Direct effects, loss of parental affection and care, as we've already seen, sexual exploitation, teenage unwanted pregnancies and planned parenthood, transactional sex for fulfillment of basic needs like food, drinking water and shelter, and safe abortions, coerced begging, and child labor. Somebody talked about Karamoja children being bought to come and beg on the streets. Permanent disengagement from formal education. There are children who have not been able to go back to school, and some are actually engaged in substance abuse and child labor. Involvement in crime, self-harm, suicide tendencies. I did not give the statistics because there are different sources, and actually some of this information has already been highlighted. And very soon we are going to experience an epidemic of fear, anxiety, and depression. The indirect effects, I think I'll quickly rush through them in the interest of time. Girl children were married off as early as possible. We had a testimony from our sister, my daughter. And the exploitation of basic human rights, domestic violence, sexual abuse has already been alluded to. And when children actually are married off early and they get pregnant, they have problems giving birth because their bodies are not mature enough either to hold the baby or to allow the baby to pass. I'm trying to simplify the language during childbirth. And that condition is called obstructed labor. Somebody talked about the fistula, which is as a result of obstructed labor due to a small pelvis, the birth canal, what you would call the birth canal. Children are already extra sensitive to emotional stress. Children are very irritable. I actually attest to this. I witnessed it in my household because of prolonged stay. And like I said, we need to prepare for an epidemic of mental health, the broad spectrum of mental health conditions. So what does recovery post-COVID look like? I already posed this question. Do we want to go back to the previous state? Do we want to do better? We have proposed some actions. It is very, we shall share this, and you'll be able to internalize and reflect on what we are proposing. But basically, we are looking at transformations within the health system, but also within the other sectors to be able to get back. We need multi-sectoral collaboration, engagement of multiple sectors and actors for transformation of the system to align it with the current and the future challenges and needs. We need to refine and align the measures of preparedness and response and measures of resilience. We talked about resilience in my earlier slides. We need to integrate resilience in preparedness and response efforts in every sector of government, public and private sectors and other sectors of the economy, agriculture, and I'm glad the Prime Minister's Delivery Unit has actually taken on this. We now have a unit that is responsible for food production to mitigate the effects of lack of food. Revisiting critical enablers, I think UNICEF already alluded to this. The software, political and bureaucratic effectiveness, trust. We know what is happening out there, how the communities are very, very, very suspicious of us health workers. And a case in point is where people have been alleging that there is actually no Ebola, that it is a tool that the sector is using to get money. These are the proposed solutions to really step up immunization coverage, although we are doing well. And then empowering communities. My colleague from UNICEF talked about primary health care, and which is about empowering communities, empowering families, individuals, to be able to promote health, prevent disease, and maintain health, to cope with illness and disability. And multiple community actors working together, civil society, religious leaders, cultural leaders, working together to change mindsets and behaviors. We need to actually try and regain trust in the health system and the quality of its product. And Ministry of Health has got very good plans. Somebody talked about low staffing levels in health facilities. There's already a strategic plan, 10-year strategic plan and a 5-year operational plan to address these challenges. Thank you very much for listening.
Thank you very much, Dr. Enid, and a special thank you to the Office of the Prime Minister entirely. Getting a doctor from the normal work environment of the hospital and getting them to speak for such long hours and be as elaborate is not an easy task. But out of everything that Dr. Enid did clearly say is one, that this needs a multi-sectoral approach. It can't be the duty and responsibility of just one person to deal with the issues of children. And in our next session, which is also going to be our last one before our chief guest gets to speak to us, I am going to request, just as Honorable Mateke, you are next to our chief guest, I will request that you walk with her back to, because the presentations are done, you walk with her back to the high table. And I'll also request Dr. Munir to still get back to the front. I'm also going to request in that the country rep of UNICEF as well to join that team. And Honorable Flavia Kabahenda, who is the chairperson of the Uganda Parliamentary Forum on Social Protection, to kindly move back to the front seat. And last but in no means the least, I will request Lydia from the Child Fund to also get to the front. I know that many of you also could have picked up a few questions you're asking yourself. There are a few things you needed to raise to probably Madame Doya or Dr. Enid, but we are going to give you that time after the next few speakers. We're going to give you a bit of time to ask those questions. So ladies and gentlemen, let's welcome our chief guest to the front, and also some of our panelists who are also going to be speaking from their own view and perspective of the organizations where they work, how this actually comes to pass. And as they do come, I am recognizing the Child Fund, the Embassy of Belgium, the Uganda Debt Network, the Embassy of Ireland, Montrose, the British High Commission, UIDEL, TMF, HelpAge International, Uganda Parliamentary Forum for Social Protection, Straight Talk Foundation, Absai Foundation, ISA, the AfriChild, the Embassy of Netherlands, the Ministry of Gender, Education, Parliament, and Media as well, and all those who are present for coming through. And did we have Honorable Kasule remaining? Please come through, the head of the delivery unit. There is no way you're going to stay where you are, and also much later on you'll do the honors to help invite our chief guest, since you are also representing the permanent secretary.